Welcome to our webcast. This is Ed Shin. I'm the CEO, co-founder of Quality Reviews, and we're continuing our Leadership in Healthcare series for the Quality Reviews webcast. And for those of you who don't know us, Quality Reviews, we help health systems, hospitals collect real-time feedback from patients, really for the purposes of improving experience, service recovery, and service excellence. It's my pleasure this week to welcome Terry Olinger to the webcast. I met Terry recently, and Terry's the former president of Great Falls Hospital in Montana. So welcome, Terry.
Great, thank you.
Well, I just want to dive right into the interview. You know, when we spoke a few weeks ago, your background really struck me. So if you could just share with us your background and how you got to where you're at now in Montana and, kind of your career trajectory.
Sure. It's kind of funny when people talk about my background. I tell people I kind of worked my way through life. Started out at community college and then went to a state school and was lucky enough to get an internship at the Mayo Clinic St. Mary's Hospital in their human resource department. Really, my focus was on more human resources in the early part of my career as I kind of went from place to place. And each spot, as I went to different locations, first in long-term care in the Good Samaritan Society in Albert Lea, Minnesota. Then at University Healthcare, part of the Good Neighbor, then later Good Samaritan in Minneapolis. We were the second largest long-term care facility in Minneapolis at the time. And very notable that we were kind of ahead of our time. This was back in the late 80s where we had an Alzheimer's unit, we had an HIV positive unit, very diverse community on Franklin Avenue in the southeast corner of the University of Minnesota campus from the standpoint of having a lot of international employees and also having a lot of folks that lived in the inner city in Minneapolis. So I really cut my teeth in a lot of different ways at the University Healthcare Center. Their biggest issue at that time was workers' comp and using contract or temporary agency employees to be able to staff their place. So turnaround there was to reduce that and do things from that standpoint. But as I've kind of gone through my career, each place kind of had a challenge. And so my next move after that was St. Joe's Medical Center in Brainerd, Minnesota, part of the Benefis system. Their challenge was really getting their costs in line with the changing landscape of healthcare, something we see almost every year, right? And then went to I went to Fargo, North Dakota, at Dakota Heartland Health System. Interesting part about that was their issue was labor relations, contract labor, but really employee relations was the biggest issue there. And finally ended up at Benefis Health System in Great Falls, Montana, which is the second largest health system in Montana. And it was really financial sustainability, very poor community, tough payer mix, 75% governmental, being reimbursed 48 cents on the dollar in terms of what we charge versus what we collect, and just the myriad of issues that have occurred over time. And as I kind of developed my career, and you mentioned turnaround, I really was used in my organization as being someone with a human resource and an operational background that could come into a department or an area and start looking at what they're doing and seeing how we can improve that. And I'll just say overall is that typically what I find is when a failing department, you go into it, many times the leadership or the staff kind of feel like they're a victim of circumstances. We don't get the results because we don't get the results, and there could be a myriad of issues. Reimbursement is bad, patients aren't there, we don't market enough, blah, blah, blah. I mean, just kind of go through it. And, I think the most common trait is not really having a plan to deal with your circumstances. You kind of go back to, I don't know if anybody understands the Oz principle, but one of the principles is that you say, but this is what I'm doing, and this is what I'm doing. I don't have enough patients, therefore, this is my plan to get more patients, or this is my plan to adjust my costs. This is my plan to get down to that area. One of the Oz principal studies, interesting thing is they talk about is being able to use this question: if your life depended on, getting numbers, what would you do different? I'd change it a little bit to say, if your job depended on it, what would you do different? But it's coming up with a plan and then executing the plan. That doesn't mean plans can't be modified as you go along. We learn, we fail, we do things, but coming up with a plan and saying, this is what I'm doing it. I just don't accept my circumstances. I do something about it. And, it's really served me well.